Hi, how are y'all doing? So my name's Lizzie Urbina, and I work for Behavioral Health Solutions of South Texas here in Pharr, Texas. I, uh, I'm a program director for Prevention Resource Center Region 11. We're going to talk about what Region 11 is in just a bit, but I do want to go back to the agency that I work for. We are a nonprofit organization and we have different programs, and some of those programs consist of intervention programs, prevention, treatment, recovery, and research. So the Prevention Resource Center is the research part of it. So I'm going to talk a little bit about that as well. So today I'm going to talk to y'all specifically about Tobacco 21 law here in Texas and why it's important for us to, first of all, be aware of it, but second of all, why it's important right now for us to pay attention to things related to tobacco and to vaping, considering the COVID-19 virus that's going around here in our nation. So I'm going to talk to y'all about the risks associated with smoking and why it is a risk factor in relation to the virus. So again, going back to Prevention Resource Center, I was going to tell y'all that the area that we cover, so Region 11 would be South Texas, and South Texas consists of 19 counties. It's a lot of counties, so we cover a pretty large area. So we cover from Cameron County, which is the most southern county in the region, all the way up to Webb County, which is like the Laredo area, and across McMullen, Live Oak, B County, Refugio County, and everything in between. So Corpus Christi area, Kingsville area, Falfurrias, it's a large area. So what we do is our team, it consists of 4 people, so I'm one of them. We also have a gentleman named Daniel Rodriguez. He is our tobacco prevention coordinator. Karen Rodriguez is our data coordinator, and Eduardo Salinas is our public relations coordinator. So again, us as a team, we do our very best to cover those 19 counties, and we go to different types of meetings from different organizations. We collaborate with different agencies. We try to work with all the sectors, and those sectors include law enforcement, school sectors, healthcare professionals. We work with colleges, universities, vocational schools. Basically, we try to bring together as much as we possibly can from those communities that we cover, and we try to collect data and we try to compile that data, and we do this throughout the year. And then at the end of each year, which for our year would be the summertime, we put together a regional needs assessment, which I'm going to talk a little bit more about that in just a bit. And that regional needs assessment is basically all that data that we've compiled throughout the year, brought together. We make it look really pretty, and then we present it and give it back to the community, you being the community. So I actually wanted to show you, I have one here with me. So this is our regional needs assessment. And again, we come out with one of these every single year. It's kind of lengthy. It has a lot of information. It's over 100 pages of data, really pretty graphs, and just kind of a really good information. And I know not everybody is a data person, but I am. So for me, I love it. But we also do data fact sheets. So what we'll do is we'll focus on a specific topic, maybe underage drinking. Today we're going to talk about tobacco, so I'll just kind of talk about that. So we make data fact sheets where the data that we've compiled, we make a one-pager, have some really pretty photos, some really kind of key findings, key data points that we feel are something that we really do need to share with the community, and then we present on those topics, and then we provide those, and so people kind of have something simple, something they can go to, something they can also share with maybe their contacts. And so again, this is a really good piece, and we do have it available on our website, which is www.prc11.org, and we encourage you to check it out. We have a lot of stuff on there, a lot of really good information. Another thing I wanted to share with y'all before I get into the tobacco part of it is we also have this, which is our regional handbook. And this, if you turn it around, it's Spanish on one side, English on the other, so we try to provide that as much as we can throughout the area. And the regional handbook kind of simplifies what the regional needs assessment has, but it has some really good tools for the parents and also for the community. So there's tools on talking to your youth, talking to your kids, or maybe even your grandkids about different types of substances, and it kind of helps spark that conversation. because we do understand that having a conversation about substance use is really difficult, especially when they're little. I know a lot of the feedback that we receive from parents and grandparents and guardians is that they feel like talking to their kids in middle school is just too soon. It's too early. They don't want to teach them. So again, we try to encourage people, and in that book it gives ways to start the conversation, and we try to encourage these parents to have the conversations, because if they don't hear it from you, then unfortunately they're going to hear it from one of their peers or see it on social media, around the media, and they'll portray it a lot differently than the way our youth need to be seeing it. So again, we have those resources available. That handbook also talks about risk and protective factors. Today we're going to focus on a risk factor, which again being smoking or using vaping devices of any sort, including e-cigarettes, Juuls, whatever the case might be. So I'm going to do my very best to stick to my topic today. If you have any questions, I know that there's a chat box. Feel free to pop in, say hello, leave a question, a comment, whatever you'd like to. And I will do my best to get to that, okay? And if I don't get to that, I apologize. I'll go through them after the fact, and if there's maybe a question that I wasn't able to answer, I'll do my very best to address that question, and then I can contact you at a later time and give you an answer to that question, okay? So I'll go ahead and get started. If my eyes avert, it's only because I do have some key points that I want to make sure that I go over today, and so I do have something just to guide me just in case. So again, please feel free to visit our website if there's something that you want to see, some data that you think might be beneficial for you or for your organization, because people do that all the time, and that's what we have it for. We also try to provide resources throughout the community, throughout our region. So one of the things that we try to do is, with the resources that we provide, we want the community to know what those resources are. And so, say for instance, there's a resource that maybe a family is not aware of, or an organization is not aware of. We want to try to fill those gaps, right? And we want to try to let the community let them know what we have available, what is there for them, because I understand everybody doesn't know every single resource that's out there, and we get that. So again, PRC is trying to be basically a central data repository where we can try to bring everything together and then provide that to you, right? So if there's, say for instance, if you look at that handbook on our website and you feel like there's something missing, maybe there's something that you're not finding that you're looking for. So one of the things I wanted to show you, I have it here somewhere, toward the end of the book, so it's on our website, there's actually a one-page form. It's very simple, and it just asks you basically, what are you looking for? And we will do our very best. It asks that you give us a maximum of 3 weeks. So if there's data that we can try to find for you specifically for something you want, we will do that. So you just send us an email with that form or request it, and we will do our very best to get that to you. So again, if it's not on the book, we'll try to find it for you, okay? So right now, just today actually, I grabbed some data specifically to COVID-19 here in not just Texas, but Region 11 being our region. Also, I grabbed some data for specific counties. So if there's a certain county that you're from that you would like to hear the numbers of either cases or fatalities, I have that available right now. So please just let me know and I'll provide that to you. But overall, I'm going to provide the regional data that I do have. So some of the resources that I used for today's presentation, I grabbed from CDC, which I know we're hearing a lot of lately with the virus going on, which is the Center for Disease Control and Prevention. I also grabbed from Texas Department of State Health Services and the FDA and the comptroller here in Texas. So those are just some of the resources that I'm utilizing today. So I'm going to start by talking about the Tobacco 21 law here in Texas. And the law got passed in September, which was a huge deal. It was really exciting because there were a lot of coalitions, a lot of communities across Texas who fought for years to try to get that to pass. So what it did was it basically passed the legal age of either purchasing, possessing, selling, or consuming tobacco. It moved the age from 18 to 21. So now if anybody wants to, again, purchase, sell, possess, or consume tobacco products of any kind, and this includes electronic nicotine devices, right? Because we know that vaping is a very popular trend right now. So this includes that. Now the person has to be 21 years old, and if you are younger than 21 and you do any of those things that I just listed, then it is actually a Class C misdemeanor, and the fine is up to $500. So I know that is a very steep fine, but there's a reason for that, right? We want to make sure that our youth and young adults are not using tobacco, because unfortunately tobacco kills more people than any other substance out there. It's really dangerous, and we know that. We know that because thankfully, with time, with a lot of research that's been done, we have found out that it does cause heart disease. It does cause so many types of cancers. It does cause so many issues. And so thankfully, we have that research now, and we know that now. Of course, there was a time back in the 60s or a long time ago where that research wasn't there. So we didn't have that information, but we do have it now. So it's important for us to, again, not only educate ourselves, but to be able to educate our youth and young adults about that. So again, exciting news. Again, tobacco products cannot be sold by somebody who's under the age of 21. So the good thing is, so again, Texas passed that in September. Well, then in December, just a few months after, thankfully, it actually got passed on the federal level. So I think with Texas passing it, it was a huge milestone, and it basically showed the rest of our nation how important this is to our communities, right? Because there's information that shows that 95% of smokers began smoking before the age of 21. So this law is trying to deter, sorry, I'm getting tongue twisted. It's trying to deter our youth from using tobacco at such a young age, right? Because the earlier that our kids and our youth are doing that, the more likely they are going to become addicted, and the more likely that they're going to end up with a chronic disease of some sort related to smoking, right? So another reason for the passing of the law is to reduce healthcare costs, which we know costs associated with smoking-related illnesses is extremely high, and there's a lot of life that's lost because of tobacco and nicotine use. So again, it's really exciting that the law got passed. I just wanted to kind of put that out there, that it's important for us to be aware of that law, right? So another thing that's exciting is now, because before when it was 18, there were high schoolers who are 18 years old, right? Seniors who are 18 years old. So this basically takes out tobacco use and nicotine use out of our school system, period. I mean, not colleges, universities, but out of the high school system, right? So I would imagine that it makes it a lot easier for school staff to be able to enforce this law, because it's basically, there should be none at all, no matter what your age is, because you shouldn't, 21-year-olds usually aren't going to be in high school. So again, thankfully, I think that makes that easier for the school staff as well, right? Okay, I hope I'm not talking too quickly. I'll try to kind of slow down just a little bit. I apologize. And I just want to say hi again for those of you who are watching. I'm so glad y'all are here. So anyway, I'll keep going. So another thing is, tobacco is the most preventable cause of death, right? So, what does that mean by preventable? It means basically if I make the choice, which thankfully I have made the choice, not to smoke at all, automatically my likelihood of my life expectancy is already, oh hey Jackie, is already going to be longer than somebody who made the decision to smoke. So it's important for us to take care of ourselves, right? And I think y'all know where I'm going with this, considering the fact that I'm going to talk about COVID-19 as well, right? So another statistic showing here that 1 out of 5 deaths is caused by smoking. 1 out of 5 deaths is caused by smoking. That is a lot of people that their lives are being lost because of smoking. And again, it's extremely preventable. All you have to do is not start, right? And if you have started, or if you know somebody who has started, at the end of my presentation, I have a resource for you to utilize for somebody who wants to quit, or would like to quit, or you want to help them quit. I'm going to provide that resource to you. So, Okay, so moving along. Again, I know it's about tobacco, but I also want to emphasize the importance of staying away from vaping as well. And unfortunately, when vaping started to become a little bit more popular in the last, I guess, few years or so, a lot of people were utilizing it as a way to quit smoking cigarettes, right? Well, unfortunately, we found out really quickly that that was not at all the case, right? Thankfully, again, research, it always takes time, but once that ball gets rolling, they started to realize all the different the issues that people were having due to vaping, right? Some of those being coughing, shortness of breath, chest pain, respiratory issues, right? So what do we know about COVID-19 as of now? I don't know if you've done any research. I'm sure you probably have. I know it's a really hot topic right now. But all of those things that I just said related to vaping are some of the side effects or symptoms that people are having when they're experiencing COVID-19. Shortness of breath, coughing, respiratory issues. They're all so similar to smoking, right? So smoking tobacco or vaping products right there is a huge risk factor, right? And that's something that we're trying to stay away from, not only ourselves, but again, our youth, our young adults. So again, going back to this law, it's so important because we're hoping that people are abiding by this law. And then if we can keep our youth and young adults away from it until at least the point of them turning 21, then the likelihood of them starting later on in life is a lot less. So that's what we're trying to do, right? We're trying to deter our youth and young adults from ever smoking tobacco products or nicotine products at any point in their life. And again, these are just some of the side effects. There's other things like rapid heart rate, difficulty breathing, nausea, vomiting, dizziness, fatigue. There's a lot of other things. So what's happening is with COVID-19, when people are smokers or have a history of smoking, unfortunately, a lot of people with a history of smoking already have some type of respiratory issues, respiratory infections of some sort. So what's happening is this virus is just basically advancing those symptoms. It's making those symptoms, I know there's a word I'm looking for right now. I can't think of it right now. But it's kind of, if anybody has the word, please share it because I can't think of the word. It's kind of, I'm at a loss for words. I'm going to say advancing. It's basically making the symptoms a lot worse than what they normally would be. So another thing is when people smoke or vape, it weakens their immune system. And again, with COVID-19, we know how important it is for our immune system to be at 100%. I know people are encouraging taking aggravating. That's a great way to put it, right? It's basically, it's like aggravating the symptoms. So it's making them so much worse than what they would have been before. Thank you, Virginia. I appreciate that. And so, again, smoking right now, smoking period is a big no, okay? But right now, more than ever, it is affecting people's health. And it's important because we're very limited on, ICU beds. We're limited on ventilators, not just here in the RGV, across the region, across Texas, across our nation, right? I have a sister who works at one of the hospitals in McAllen, and she's been working there for many years. I'm probably over a decade, and she's starting to see how much of a shortage there is on things that are needed specifically for people who are suffering from COVID-19. And unfortunately, again, other illnesses, or of course, people are going to the hospital normally the way, for things that they normally would have, right? But now more so because people are starting to feel these symptoms of things that they're unsure about. And so I understand that it's a very sensitive time right now. But again, it's important for us to take care of ourselves, because if we do our best to take care of ourselves, then we take care of our community as a whole, right? Our nation as a whole. So again, taking things like smoking out of our lives would help drastically. It would help so much. So again, I encourage you, please, if you know somebody who smokes, again, I'll share the quit line with you in just a little bit, so you can share that with them, or share this video with them, and then just so they can, understand how important it is to stay away from that, right? Okay, I'm going to move along. I apologize. I only have a few more minutes left, but I did want to share with you all some of the cases here in, thank you, right there. There's our PRC website where you can find some of the data. And I wanted to share with you some of the cases. Again, I got this today, and I do know that the state has done a really good job on updating these numbers every day, if not every other day. So this was updated as of, I got it today, but it was updated as of yesterday. So here in Texas, as of, again, yesterday, there have been 18,923 cases of COVID-19 reported, right? These are cases reported. And then in Region 11, which I told you are the 19 counties that consist of South Texas, which is what PRC covers, there are 958 cases that have been reported. So again, those are some significant numbers, but at the same time, it's changing on a daily basis, right? So it's important for us to keep up with this. So I'm going to move on to the fatalities. And again, I have this data that the state has on their website. It's available to the public, so you can find this at any time of the day. So the fatalities that I was able to get in Texas, there are 477 as of yesterday. In our region, again, Region 11, 19 counties here in South Texas, as of yesterday, there were 22 fatalities. So most of them being in the Webb County area and also in Cameron County area. Hidalgo County area is up there as well, but on fatalities, again, more in Webb and Cameron County. So again, I have it broken down by county. So if that's something you would like specifically, please let me know and I can share that with you, okay? And also, again, the website, I'll give it to you right now where I got that information, which is www.dshs.texas.gov/coronavirus. And it'll have all sorts of information, a lot of it that I shared with you today, but I encourage you to stay updated. But while I say stay updated, I also encourage you not to dwell too much on it, right? Because we know that it's important for us to take care of ourselves. And by taking care of ourselves, that's not just physical, but also mental. So me personally, I've actually removed myself a lot from the news only because I was feeling a little overwhelmed in the beginning. So I encourage you to just be very careful because we want to take care of our bodies, but we also want to take care of our minds, right? And so it's important for us to be updated, but at the same time, it's important for us not to overwhelm ourselves, right? So we need to take care of ourselves in that sense. So again, smoking or vaping puts people at a much higher risk where the COVID-19 could become worse for them. So again, I encourage people to quit smoking if they haven't already done so, and I'll share that quit line in just a few seconds. And again, smoking and vaping does damage the lungs and weakens the body's immune system, which right now, more than ever, we need our immune system to be at 110%, right? And so if you know somebody who smokes, encourage them to please quit. Encourage them to, so this is the quit line. I'm going to share it with you. The quit line is going to be 1-877-YES-QUIT, which is yes, quit. So the number for that is actually 1-877-937-7848. So I hope that you got that. If not, just rewind it and and check it out. And again, share that because it's important for us. Again, not just for health, but we want to help our hospitals. We want to help our medical professionals, our health care professionals, and we want to. This is a nationwide effort right now. And so we need to each do our part, myself included, to take care of ourselves, right? And so what can we do, before I let y'all go, what can we do to take care of ourselves, right? Talk about it. Let's have conversations with our youth, with our young adults, with each other, right? It's important for us all to stay educated. And we need to talk about what's going on, what's helping us during this time, what's maybe not helping us so that we can encourage each other to stay away from those things. And listening. Listening is so important, right? So there's obviously listening and there's hearing, right? We want to actually listen to people, take it in, and just be there for them, right? I know we can't be there for them face to face right now, but there are so many things available, video chat, FaceTime, house party, whatever way you have, stay in contact because that's important and that helps. that's a protective factor, right? And it's important, if we have our risk factors, we also have our protective factors. So our protective factors would be supporting each other, being there for each other. I'm sorry about that. Guiding each other, right? So not only just being there, but also, okay, if you have a resource, lead them to that resource, right? And again, our website, we have a lot of resources. So if there's something you need, please take that. I myself, as you can tell, am working remotely, but I am most available via email. But we do have staff who are working. Our treatment and recovery staff are still working in the offices, and they're doing everything that they can. So if you or somebody that you know needs those services, please contact our main organization. And I know the information is on there. Our phone number is on there. The quit line is on there. All the information you need is there. So please, again, reach out, and we want to do our very best to help you in any way that we can, and share those resources with you, because that's the most important part of not only PRC, but our organization as a whole. So, so before I let you go, the very last thing I want you all to leave with is, before you go, I want you to stop and think about one or more things that you are grateful for today, and ask yourself every single day, what's something that you're grateful for, right? And I know we have a lot to be grateful for. I know there's a lot going on, but I think it's important, again, let's focus our attention on things that are positive. So think about one thing that you're grateful for, right? And then I think the second thing I want to ask of you is, ask yourself, who have I checked in on today, or who have I connected with today? Because I know I've been talking about resources and this and resources that, but we ourselves can be resources, right? So we can be our family or our friends' resource as well. So just remember to check in on those that you love, those that you care about, and make sure they're doing well from a safe distance. And I know all the things, wearing a mask, washing your hands, those are all very important things that we should be doing. But again, there are virtual ways for us to check on each other. So I'm going to wrap this up. I appreciate you for sitting in on this. I hope you were able to take a little something from it. Again, our website is going to have a lot of information, and please check it out. I know it's in the comments, so www.prc11.org. We encourage you to check that out, and look out for more of these videos. Our agency is going to be doing different videos on different topics from different programs. So I know that's a lot of different, but keep an eye out for them, and I hope that you really can benefit and take something away. Y'all stay safe, stay well, and remember, if you know somebody who smokes, encourage them to stop. Okay, y'all have a good one. Bye, guys.